Thank you, Mary. First of all, I just wanted to have you all refer to a canary-colored handout that you should have that should be labeled S1400 Registration and Study Flow Form. And this is just going to be an abbreviated workflow diagram similar to what I'm going to go through now, just for your reference for later. And like I said, I'm going to cover the process for the patient enrollment on S1400. So first of all, in the pre-registration period, after you complete your background recruitment and screening, for patients found to be potential candidates, you'll consent and verify S1400 eligibility. That's going to be located in Section 5 of the main protocol. And one of the requirements is providing the tumor tissue, as Dr. Hirsch talked about. If you have worked with study S0819, which is one of our ongoing lung trials, this is going to be a familiar process to you. The preference is obviously for the tissue block submission, but you can substitute 20 slides with the absolute minimum being 12 slides. And your local pathologist must confirm and sign on the local path review form that a 20% minimum tumor cells are available in the specimen. And again, here for more details, you can refer to Section 15 of the S1400 protocol. So we'll be using the CTSU Open program for all S1400 registrations, and more details on that are available in Section 13 of the protocol. In addition to the normal demographic info, we'll ask 2 additional questions. Has the patient progressed on frontline therapy? As well as provision of 2 email addresses, one primary and one backup, to which the notification of specific sub-study assignment will later be sent. And I just want to note, it's crucial to ensure the emails are entered correctly and reflect active, frequently used accounts. And at the end of registration, the patient will be assigned a 6-digit ID number that'll have a leading 7. That's to distinguish it from other SWOG registrations. And this is unique to S1400. Previously assigned SWOG IDs will not be used. All patients will be registered as new patients for this specific study. So after registering the patient, one important point to note about the tissue submission is the very tight time frame, which is going to be 1 day after registration. And it's very important to observe this turnaround time to expedite the patient's sub-study assignment. So be absolutely sure to log the specimen into the SWOG specimen tracking system, as we will use this data to monitor specimen submissions. And review Section 15 of the S1400 protocol for additional details regarding the specimen requirements. So sub-study assignment will be both emailed to the primary and backup emails entered during the registration and displayed as well on the sub-study assignment form in metadata rave. The time frame for email receipt depends on the patient's frontline therapy progression status that was entered at registration. So if the patient progressed prior to registration, and assuming tissue was submitted 1 day after registration, the assignment will be sent within 16 days of registration. If the patient progressed after registration, at which point the site would submit the progression notice form, the assignment will be sent within 16 days of that form submission. Now that you have the sub-study assignment, you'll need to confirm the patient's sub-study eligibility. This is split into 2 sections. The criteria common across all sub-studies in S1400, Section 5.2, and the criteria specific to the assigned sub-study located in Section 5 of that sub-study. And there is a 28-day time frame from receipt of the assignment email to complete this and register to the sub-study. Once you confirm eligibility and register to the sub-study, the patient will be randomized to either the investigational therapy or the standard of care arm. So you must plan to have the patient start the regimen to which they were randomized within 5 working days of registering to the sub-study. Investigational therapy can be ordered per the instructions in Section 3 of the substudy at the link seen here. You can the contact info for the Pharmaceutical Management Branch, PMB, who are managing distribution, is also listed here. And please review especially Sections 7 and 8 of the substudy for treatment and dose modification details. So I'm sure you're wondering, what if your patient doesn't meet the eligibility for one of the screening points? So here's a couple scenarios. If your patient meets the substudy eligibility criteria that is common across all substudies, but does not meet the eligibility criteria specific to their assigned substudy, you can submit the request for substudy reassignment form to check if your patient qualifies for one of the other substudies. You'll then receive a reassignment email, reevaluate for the new substudy, and register if the patient is eligible per the steps on the previous slides. If your patient either does not meet the common substudy eligibility or does not meet the assigned specific substudy eligibility and does not qualify for any other substudies, then you'd need to submit the Notice of Intention Not to Register form and just follow the patient and submit forms per the S1400 main protocol. Other instances when you would submit this form include if the patient decides not to participate in a substudy or if they die prior to being registered to a substudy. And just to rehash a little bit with some additional information, we'll be collecting all data submitted for the study in metadata rave. And for protocol documents, etc., for S1400, for SWOG institutions, you can find them at the SWOG.org directions here. Or for CTSU, you can find the ones listed for CTSU.org. If you have any other questions on registration or data submission, just contact SWOG Data Operations, also as Dr. Redmond said, at lungquestion@crab.org, and we'll be happy to help. And I just want to thank you in advance for your participation on this trial.